at for Medical Jobs channel. And same premise and same process is finding us on Instagram and Facebook and YouTube, and our website right now is www.goldmedicaljobs.com. So there will also be Medical Jobs channel website as well. So they will be incorporated, and they are for healthcare employers and healthcare workers to find one another, to find jobs, and to seek good employees. So that's us. I always talk about us. If you already know, I apologize for being repetitive, but I thought we're all so focused on this pandemic. How could we not be, right? I hope you all feel well. And so what occurred to me, because of my own personal experience with family members in my community and so forth, and in my discussions with some of my colleagues, is that we are so focused on COVID-19, the novel COVID-19, that we are, as healthcare personnel and as medical professionals, and although technically the diagnosing is left up to the physician, we nurses primarily and respiratory therapists and all of those people on the front lines working in facilities and hospitals and long-term facilities are constantly assessing and evaluating patients. And so, excuse me, and so I thought we really should probably not neglect, and I think that's what's happening. We are so focused on the virus that we may be neglecting to seek medical attention or report symptoms and so forth that also need care. The common cold, not necessarily, but the common cold left untreated or left with somebody who is already impaired or suffering from other medical conditions, you know, such as diabetes and cardiac problems or respiratory problems or any problems, recovering maybe from a surgery or recovering from some generalized muscle weakness related to disease processes and so forth. So these compromised patients, if they suffer too long with a cold, their immune system takes a hit, and then they're more vulnerable to other diseases. So I thought it would be a good idea to talk about paying attention to other signs and symptoms, and there are so many. There are so many diagnoses in the acute settings. In the if you're ever looking around for so information, it's always good to have your own information. But if you're ever looking around for the right facility for a family member, or if you're taking care of someone in a acute setting and they are going to be transferred to a longer term setting, there are so many, like 100 or more diagnoses for the long-term facilities. I have access to a list of about 50 myself, but I know that's the tip of the iceberg. So I do want to say there's 100 or more coded diagnoses for admitting people into skilled nursing or LTACs or any type of long-term medical care facility. So good to be aware of that too. And I'll talk a little bit about that. Maybe I'll do a little Q&A at the end of which one doesn't, you know, we'll do a little process of elimination quiz, okay? We'll do that at the end. But right now, let's focus on signs and symptoms of 1, the common cold, 2, the seasonal flu, and 3, I don't know why we call it seasonal, because you really could get the flu at any time. It's more prevalent in certain months between, I want to say, the fall and the winter. So, but it doesn't mean you couldn't get it now. Okay, so, and here we are in April April 16th. Oh, I just have to, I always digress, but I hate to not give you some information that I find pretty interesting. So I want to say happy National Pajama Day today to everyone. And I think it's also interesting that National Pajama Day falls the day after taxes. Although most of us, my mom, I was just talking to her, we're getting her extension to July 15th. And I haven't talked to my husband about ours because I didn't think of it till just now, actually. But so on that, I find it interesting that National Pajama Day, don't know how it started. That's some other research that I haven't done. But that nurses, especially now that we get to wear scrubs, we've been wearing scrubs for years. When I started my nursing career, a long time ago, like 100 years ago, no, it was the 70s. And in the 1970s, we were still wearing white, and we were still wearing caps for the most part, and white hose and white highly polished shoes. And oh God, I had earth shoes. I had some cute shoes to wear with my dresses, actually. I thought I kind of like some of my nursing shoes, but some of them during nursing school, we were wearing the white Oxfords. And I got a lot of tips from more seasoned people, because not everybody goes straight from high school into college. And so some of the nurses, it was a second career, and I was a nursing student alongside more mature people at the time. And I got a lot of tips on how to keep things white and starched and how to get my shoes looking fantastic. To this day, I still use Mrs. Smith's bluing when I do whites. Okay, but at any rate, I mentioned Happy National Pajama Day because my pajamas are like my favorite clothing, and I've been wearing a lot of pajamas because I've been housebound, and I get up early to hang out with my granddaughter, so a lot of times we're still in our pajamas. And I feel like nurses kind of get to wear pajamas every time we work. So all my nursing colleagues and all my friends out there, and all of you who I feel committed to, all the nurses and healthcare workers, enjoy Happy National Pajama Day, because you're probably wearing scrubs. Okay, yeah, so you can enjoy this holiday at work in your scrubs. And thank you for being at work and being on the front lines. And please know that I am praying for you. And you are probably one of the higher populations at risk. So please take care of yourself. Use your bloodborne pathogen protection and all the additional protective equipment you can get your hands on that you need, particularly if you're working in ICUs or ERs. Take care. All right, now back to the topic. Let me go through a list. I have it here. Make it so I can still look at you. Let me give you a couple of like basics. Like let me give you like the top 5 of what you see in a patient that has a cold, what you see in a patient that has the flu, and what you see in a patient that has COVID-19. And believe me, it's not that easy to differentiate, okay? If you're the patient yourself, listen to the patient and what they're explaining and how they feel, because they can give you a lot of information just in their own interpretation of what they're going through. So let's start with the incubation period. For the common cold, it says 1 to 3 days. I think it can be longer, but 1 to 3 days for the cold. So pretty fast, I'm sorry, pretty gradual onset, right? 1 to 7 days coming at you with a cold, like, I think I have a swollen gland. No, and then the next day you're fine. And so it sort of plays around with you till it really grips you. Anyway, flu, same thing. 1 to 4 days in a site, a healthcare site that I'm on. So 1 to 3 days for a cold, 1 to 4 days for the flu. Here's the difference with the COVID. 1 to 14 days incubation. You don't know anything. You may not have any symptom, or it may be so mild you barely notice it. Now, that's interesting. When you do get the cold, the onset is very gradual. When you do get the flu, it's like you got hit by a truck. So it's a very sudden, in either day 1, 2, 3, 4. When you get it, you know it. It's awful. It's awful. So the symptom onset for the cold is gradual. Symptom onset for the flu is sudden. And here we go, COVID-19. It's what's messing everybody up and why there's news every day on it. It can be gradual or sudden. Well, yeah, it's got that long incubation period, so you don't know. You don't know if it's been brewing. All right. Do you have a fever with the cold? No, usually not. If you do, it's very low grade. So usually not a fever with the cold. Do you have a fever with the flu? Oh, yeah, you do have a fever. Yeah, and it goes on for a couple of days. And do you have a fever with COVID? Now, this report is saying common, but I had friends, and when it's a low-grade fever, a lot of times people don't notice it. But I have 4 friends that had COVID-19. They're pretty much out of the woods now because they were in week 3.5, I think. It's been over 3 weeks for them, so they're finally feeling a lot better and no symptoms. But fever was common, and actually 1 out of 4. So that's my own personal, but this healthcare site says that fever is common. So it is possible they had a fever and they weren't aware of it, and only the one with the high fever was aware of it. And he could hardly get out of bed. Do you have a cough with a cold? A lot of times you do. Mild, not usually, you know, where you can't stop coughing and, you know, it's just a cough, okay? I think for many of us, the most common sign of a cold coming on is you just don't feel well and you get the scratchy throat, okay? But cough, so we're going through incubation period, symptoms onset. Now we're up to the cough. So the cold, mild to moderate cough, and you're able to deal with it. And not everybody even gets a cough with a cold. It's often just the stuffy nose and so forth. So with the flu, it's very common to have a cough, and with the COVID, it's very common to have a cough. And I will say, my 4 friends all had a cough. So do you get fatigued with the cold? Not usually, not that desperate like, oh, I can't hold my head up. I just like, oh, yeah, I remember having the flu. I had it for a very long time, and it was complicated by some respiratory stuff. And I could, you know, make it into, I worked in an office, so it was fairly safe, but I could not work a full day, and the fatigue was intense. So with the flu, you will see fatigue. Usually with the cold, you will not. Maybe sometimes a little bit, but not really. And with the COVID, yes, very fatigued. Can't do, you know, not the day to clean out your garage. So fatigue is common in the flu and the COVID. And are we seeing something here? There are a lot of similarities between all 3. That's really kind of rough. Yeah, yeah. Fever's common with the COVID. Fever's common with the flu. Cough's common with the COVID. Cough's common with the flu. What about a runny nose? Okay, that's the cold. The cold is the runny nose, the sore throat. I feel yucky. My mouth tastes yucky. My nose feels yucky. And that's your cold. Do you have that runny nose with the flu? Not necessarily. Do you have that with the COVID? No, not necessarily. But I have heard of these symptoms of feeling like you were swimming in salt water, like funny, odd, peculiar things in your nose. A lot of my friends, out of those 4 people, I think 2 or 3 of them had that inability to smell and taste. And I said, can you explain that? And my friend said, well, the cat food drives me nuts. As soon as I get into the room or even near the room where the cat food is, I hate that smell. And she goes, I can't smell it at all. You could put a can under my nose of cat food and I don't even smell it. So that's an interesting thing. That's not listed here on my healthcare site, but yeah, so the runny nose is not common. The nasal congestion, no, that's your cold. So runny nose, congestion, sometimes, yeah, congested nose, just congested feeling, upper respiratory congestion. Those are all very common with the common cold, and that's why you're kind of miserable. They're icky. You just want to be normal and feel good and take deep breaths and do your exercise and do your work. So the common cold is annoying, but it does have these little icky symptoms. Is nasal congestion goes along with the flu or the COVID? It could. It's a sometimes, but you can definitely expect it with a cold. And so I have a family member right now, my daughter, who just gave birth 3 weeks ago. She has had a cough. She has had a cold, and she has had not a runny nose, but a congested nose. She's had mucus and so forth. So she is seeking medical attention because it's gone on for quite a while now, like 2 weeks. So she's been so busy taking care of the baby. And I said, okay, that's enough of that. You need to let your doctor know what your next steps are. And she may or may not be tested for the COVID because it's not typical. Her symptoms are typical cold symptoms. She has not had a fever. She hasn't had any serious fatigue. I mean, enough fatigue for, feeding the baby half the night. But I help her during the day, so that's nice. But she has had this cold that isn't going away, so we need to get her checked. And she's already got her calls into her teledoc and all that. So let me take a sip here. Stay hydrated, people, and keep your windows open. We're going to get through this. Okay, so yeah, so okay, it's just crazy. It's just crazy. Are there body aches? It's kind of, sometimes it depends. And that's with the cold, not usually with the cold, but with the flu and with the COVID, sometimes there's body aches. Sore throat, sometimes with the flu and the COVID, but it's rare. Body aches are rare with the flu, with the cold. So the cold are the milder symptoms. The cold is usually a sore throat, gradual onset. I think I'm getting sick. Oh no, that was yesterday. I feel better today. Oh, here it is Thursday. Oh, I feel bad again. So the cold is just sort of like, am I going to get this cold or not? And then you get it, and it's mostly annoying. And a lot of the over-the-counter things will help you. If you feel congested, maybe you want some Guaifesin, Mucinex, or Robitussin or something. A lot of symptomatic relief for the cold, symptomatic and effective. So sore throat, runny nose, or sneezing, and so for those are your cold symptoms. Do any of those show up with the flu and the COVID? The answer is yeah, sometimes. Sometimes you do have a cough. Oftentimes you have a cough. Sometimes you have a fatigue with the flu. You will definitely have it with the flu, and you'll most definitely have it with the COVID. My friend said her husband could not even get out of bed some days, and she would push him to come sit down and have a sandwich for lunch or soup or something. And yeah, so a lot of these symptoms, headaches and fevers, and fevers is very typical of the COVID. But I'm telling you, my personal experience is only 1 out of 3 had it. And they're back east, and so I couldn't tell you, but I think myself as an adult, I'm really sensitive to a change in my temperature. So I will get chills at the slightest fever. I won't even hit 100, and I'll be like, oh gosh, I have a fever. My fingertips get cold, and because my core gets hot. And so I'm very, very sensitive to fevers, but not everybody is. So they might not really notice a fever or have the chills until it starts really climbing to the 100, way past 100, 102, 103. So, so there you go. So what's my point? Here's my point. Don't forget to take care of yourself. Whether you think you have the COVID virus or whether you just think you're sick and not getting well. That's why we have medical professionals to help you to get through this, to get well. We're here. We call it health care. We care about you being well. So if you're working in an acute setting, if you're working in a clinic, if you're one of those wonderful people doing the drive-by testing, which has been very, very efficient for, particularly back east in New York, where the hospitals they're bombarded with so many illnesses and so many COVID viruses. So you can go through, get your questionnaire. They do your sample, which is, I think, sounds icky. They do nasal swabs to test you for the COVID. And it's very, very efficient. Once you make contact with your healthcare provider or your community, whoever you're seeking help with, they will direct you what to do, where to go. And then once you know, it's actually pretty efficient. They've really set up some really efficient um, mobile setups for everybody. My nose, my nose is itchy, and I do not want to touch my face, although I've touched my hair a couple of times. And so what I want to encourage everybody, and I'm sure you're doing it, you know, we're all about signs and symptoms, and nursing diagnoses are all about that. When you're assessing and reassessing your patients and your clients, is don't neglect to report and to communicate signs and symptoms that may or may not be COVID-19, right? It may be a flu, it may be a cold. Can those lead to pneumonia? Oh yes, they can. Is that something to be concerned about? Yes, because certainly with COVID, the worst symptoms with the COVID are that fever and that dry cough lead to shortness of breath, and the shortness of breath leads to pneumonia and leads to rapid acute respiratory syndromes and kidney failure and death. I mean, that's what COVID does. The flu can do that as well. We have many, many deaths every year attributed to the flu, particularly in our more at-risk population, which I always mention. I feel like I'm so redundant. I apologize, but you know, the more vulnerable of our community are our elderly, and the more at risk are the elderly and the very young and the very old, and those with underlying health issues with, you know, pulmonary problems or cardiac problems or diabetes, hypertension. All of these put you more at risk. A lot of my friends have, you know, we're not the youngins anymore, so we have different autoimmune things that come up, maybe that we just didn't know about when we were younger, or didn't manifest, or have an onset that comes with later life. But friends of mine that have psoriasis, that have so many different things that affect your immune system. Autoimmune diseases, lupus, rheumatoid arthritis, you know, different things that put you at risk. Your immune system is compromised. Diabetes, whether it's diabetes type 1 or type 2, your immune system is you're more at risk than someone who does not have diabetes, who does not have rheumatoid arthritis, who does not have psoriasis. There's so many more. I can't think. I can't. If I don't write it down before I talk to you, I start second guessing myself. Okay, so I blah 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 now for well over 20 minutes, and I promised you a mini quiz, so I'll give you a mini quiz here. Let me see. Okay, so I'm going to give you a bunch of diagnoses for patients that are admitted to long-term care or skilled nursing facility. When I talk about long-term care, there's this sort of wide range of long-term care. You know, a lot of the chronic LTACs, we call them, long-term acute care hospitals, they fall under a different umbrella as far as coding and diagnoses than a hospital. So a lot of the chronic pulmonary, the chronic cardiac, those essential diagnoses are reasons for admitting patients to long-term acute hospitals versus an acute hospital. So anyway, this is sort of a general diagnoses for being admitted to skilled nursing facilities, to long-term care. And you tell me which one doesn't belong. So let's see. 1, pneumonia. 2, urinary tract infection. Aftercare joint replacement. 3, weakness. 4. Chronic obstructive pulmonary disease. 5. And heart attack. 6. Which one doesn't belong as an admission diagnosis for the long-term facility? Now, can I remember what I said? I said pneumonia, number 1. Urinary tract infection, number 2. What did I say after that? Urinary tract infection. Gosh. I'll start again. I'm so bad. I'm so bad. Okay. Which one doesn't belong in this category as a diagnosis for being admitted to a long-term facility? Pneumonia, urinary tract infection, aftercare for joint replacement. What did I say? Oh, chronic obstructive pulmonary disease and weakness and heart attack. Dum, 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 dum. One of those doesn't belong. They're all diagnoses. They're one of hundreds of diagnoses for being admitted to a hospital or a facility. But 5 of them are specific to being admitted to a long-term care, a skilled facility versus an acute facility. The one that doesn't belong, you probably all know, it's the heart attack. If you're having a heart attack or you think you're having a heart attack, you don't call up and say, I think I need to go to the skilled nursing over there on the boulevard. No. If you think you're oh, there, touched my face. Now I have to go wash before I go near that baby. Anyway, if you think you're having any signs and symptoms of a heart attack, or your loved one is having signs, or anyone that needs your help is having a heart attack, they belong in the hospital. Lickety split, to the hospital, to the ER, head of the line. Anybody that's bleeding profusely or having a heart attack needs care right now. Same thing with cerebral infarction. Yeah, the sooner you get care, the better. That is acute, and that is not who you're admitting to the long-term care. Okay, the more chronic, the ones that need more time to heal, because most hospital visits are pretty short. There's probably a statistic on that. I would say the average is probably 3 days, 3 to 5 days. And if you wind up in an ICU, it's a whole different story. But general admission and admitting diagnosis to exiting the hospital are pretty brief. So, and that's what the insurance and so forth mandates. But long-term facilities, they fall into different categories and they have different coding. And so things like urinary tract infections and pneumonias and chronic obstructive pulmonary disease and whatever else I said, something about joints, aftercare joint replacement. So joint replacement is going to occur in the acute setting, but then the time it takes to rehab and so forth and do all the preventative measures you need before you go home, that occurs in a skilled or long-term facility, right? Okay, so great talking to you. We're Gold Medical Jobs. I'm Rita. You can visit our website www.goldmedicaljobs.com. You can email me, or you can be on the lookout. It should be coming soon. We are changing our names to Medical Jobs Channel, and you will find us at that website or Facebook or all the places that we go, which would be Facebook, Instagram, and YouTube. These videos will be on YouTube. And I thank you very much for watching, and I hope you're staying well, and those that you care about are staying well. And don't forget, it's just not COVID-19. There's a lot of things that we have to pay attention to at home and at work, and seek medical professional help when some of those symptoms occur. Okay? Thank you so much. Bye.